Hi everyone, happy Thursday. Hope you're all having a wonderful day so far. For those who may not know me, I am Susie Leachy. I'm a certified health coach and I specialize in women's health, and in particular I help women to balance their hormones and boost their fertility. So today I just want to talk about a topic that has come up with a couple of my clients, and I tend to see questions about it and sometimes some misinformation floating around about it. So I just wanted to chat a little bit more about it today. So that topic is AMH, or anti-Müllerian hormone. Hi Lizanne, thanks for popping on. How are you? And AMH is a hormone that is produced by the cells in your ovarian follicles. And it's important because it's typically regarded as a good indication of your ovarian reserve, or basically how many eggs you have left. So essentially, the higher the AMH level, the more eggs you supposedly have left, and the lower the number, the fewer eggs you have left. Now, AMH levels, as you can imagine, naturally decrease with age because we lose eggs as we age and as we ovulate, of course, and fertility tends to decline with age. These AMH levels can also be elevated, though, in women with PCOS. So it's not always a direct measure of ovarian reserve, since it can be really high in women with PCOS. That doesn't mean they necessarily have a ton of eggs. It's just because of their condition and kind of the overstimulation and all the follicles that are developing with PCOS. So usually, just to give you an idea, usually fertile women without PCOS, so we're going to kind of exclude women with PCOS just for the purposes of this discussion, but the AMH ranges normally are from about 1 to 4, and that's in nanograms per milliliter. Less than 1, so an AMH of less than 1 nanogram per milliliter, is often considered a sign of diminished ovarian reserve, while again over 4 would be a sign of PCOS. So kind of between 1 and 4 is sort of considered the sweet spot for fertility. But what I do want to emphasize, and what I kind of alluded to before, is that AMH is definitely not a perfect measure of ovarian reserve. Not only because women with PCOS tend to have a higher level, which doesn't mean that they, have a ton of eggs necessarily, but also because if it were the case that it were just a measure of ovarian reserve, then we would only see AMH go down as a woman ages, assuming again that she doesn't have PCOS, and the number should never go up because we're only losing eggs as we age. We're not making more eggs as we get older, right? But what is seen in practice is that AMH levels can actually go up. So if you are someone who is hoping to increase your AMH level, I am just going to tell you about a few ways to do it naturally. And this can be especially important if you are someone who is considering or already undergoing IVF treatments or egg freezing, since of course you want as many eggs to be retrieved as possible for those types of procedures. And although I do really strongly encourage you to focus heavily on egg quality and not just quantity, because that is super important. Of course, the quality of your eggs. I mean, you can have a ton of eggs, but if they're not good quality, then you're not going to be able to get pregnant and have a healthy pregnancy and a healthy baby. And you really only need, 1 or 2 or, however many babies you intend to have. You only need that many quality eggs in order to have your children. You don't need, 20 eggs necessarily. So focusing on quality is super important. So maybe I'll do a video next on improving egg quality naturally. If that's a topic you would like me to talk about, please just let me know in the comments or send me a message and I'd be happy to do that. But anyway, okay. Some things you can do to naturally increase your AMH level. First off, vitamin D is very highly correlated with AMH levels. In fact, there was one study that showed that AMH levels decreased by about 18% in the winter months when of course vitamin D levels tend to be a little bit lower since you're not getting as much sun exposure, and sun exposure is one of, the best ways to get vitamin D. So that just kind of shows the correlation between the two. So getting sufficient vitamin D and having an optimal vitamin D level either through the sun or through supplementation or a combination of the two can definitely help to increase your AMH levels. And again, that's been shown in studies and in practice. But I do encourage you to get your vitamin D level tested before, running out and getting a vitamin D supplement, because it is one of the fat soluble vitamins. So vitamins A, D, E, and K are all fat soluble, which means that they are stored in your fat tissues and you can build up to a toxic level in your body. It's not like where you take some other vitamins like vitamin C or B vitamins where you kind of just excrete any excess when you pee. You won't pee out vitamin D because it's fat soluble, so you really don't want to overdo it. So you want to get your levels tested before considering supplementation. And what you're looking for in terms of vitamin D level is that optimal range of about 50 to 70. So some labs will say, if it's over 30, you're fine, but really you kind of want to be in that sweet spot of about 50 to 70. And again, that's in, just like the AMH levels, that's in nanograms per milliliter. Okay, the next thing to help increase your AMH levels is DHA. So again, just like the vitamin D, this is something that you definitely want to get tested before you consider supplementing, because since it's a hormone and it can be high in some women, especially women with PCOS, sometimes they have elevated DHEAS levels. So you definitely want to get that tested before considering supplementing. However, if you do get tested and it's on the low end or even in the middle of the range, supplementing could be something to consider until you're in the upper 20% of the range for women who are around age 25. That's kind of the sweet spot for increasing AMH levels. Okay, so let's talk about a coenzyme in your body, and that is coenzyme Q10 or CoQ10. And that is a coenzyme that tends to decrease with age, and it's been shown to help with fertility when women supplement this and when they have higher levels of CoQ10. And it may also help to increase AMH levels. So that's another supplement you may want to try if you know that your AMH levels are low, or if you're a little bit on the older side in terms of fertility. And by the way, if you're going to supplement with CoQ10, I do recommend supplementing with the active form, which is ubiquinol, as opposed to ubiquinone. If you have questions about that, just ask me, but it's a little tip for you. It's much better absorbed than the standard form that you may find, which is ubiquinone. Okay, so then lastly, in terms of supplements, antioxidants can be helpful as well. So, vitamin C is one, as well as myo-inositol. You may have heard me talk about inositol before. It's a really great supplement for women with PCOS. It's also great for egg quality in general. So that could be another thing to look into. Comes in capsules, comes in the powdered form, and the powdered form is honestly really affordable, just so you know. So yeah, myo-inositol. And all right, let's move away from the supplements now and talk about stress. So this is another biggie, and managing and reducing stress, as you may know, is very important for overall health and of course for hormone balance and fertility as well. So stress definitely has a big impact on AMH levels. So just finding ways to reduce or manage your stress can be really important if you do have low AMH levels. I do have some stress management tips in another video that I did, if you want to check that out. It was earlier in the year that I did it. I think it was in January, and it was how our attempts at stress management backfire. Was it in January? I don't know. I think I was thinking of the New Year's resolution one, so maybe it was a little later, but you should be able to find it. It's on my YouTube channel if you're watching there, or in my Hormone Balancing, Fertility, and Beyond group. If you're watching there, that's where I'm currently live in. And okay, lastly, I just want to mention that you always want to be looking for the the root of any health or fertility issues that you're having. The root cause is really important. So if you have any underlying issues like digestive issues or hormone imbalances or thyroid issues or stress of any kind, back to stress, physical, mental, emotional stress, any of that. And those can all be related, by the way, of course, like nothing happens in a vacuum in your body. So if you have those stressors, that affects your hormones and your thyroid and vice versa. So just something to keep in mind, but you definitely want to be addressing any of those underlying issues if you want to boost your fertility and increase your AMH levels. So those are the ways to naturally increase your AMH levels. So again, we talked about optimizing vitamin D levels, which is very important, optimizing DHEA, and again, you want to get those two tested before considering supplementation. We also talked about CoQ10 and how that can be a great supplement, especially for women with low AMH or who are, a little bit older and trying to get pregnant. And we also talked about managing stress, also super important for overall health and fertility and for boosting your AMH levels. And lastly, we talked about addressing any underlying root causes or health issues that you may be having. So, if you have any questions, feel free to reach out and let me know. But that's just kind of a quick overview. And I will also remind you that I have a one-on-one coaching program for women who are trying to get pregnant. It's called Pathway to Pregnancy. I also have a similar program called Pathway to Hormone Balance for women who are not currently trying to conceive. And both of those are one-on-one coaching programs with me. So you'll get tons of support from me, and I walk you through step by step what you specifically need to do to boost your fertility and balance your hormones. So it's very individualized approach, and that way you can be well on your way to either getting pregnant, having a healthy pregnancy, or to being relieved from whatever nasty symptoms you're experiencing because of your hormone imbalances. Hi Clary, how's it going? Hope I pronounced your name correctly, by the way. I was just chatting about how to naturally increase your AMH levels, and just wrapping up with chatting a little bit about the one-on-one coaching programs that I have. So this sounds like something that you could benefit from, this one-on-one coaching program, either program, Pathway to Pregnancy or Pathway to Hormone Balance. Or if you know someone who could benefit, just feel free to reach out to me. I can give you a little bit more detail on it. You can, comment or send me a message, whatever you would like. And we can also hop on the phone and chat about it, see if it's the right fit for you. And I don't always have openings for these programs, but I do have an opening right now. So if you are interested, then just, let me know. And if you would like my top 5 tips for boosting your fertility, just head over to my website, which is healthequilibriumcoaching.com. On the homepage there, you can put in your name and email address, and you will get access to that free guide. I have another freebie too for you ladies. Maybe some of you have already accessed it, but it is a 5-day meal plan to help you regulate your cycle and get pregnant. It's also just has a lot of meal and snack ideas for, just healthy eating in general, and blood sugar regulation, and, fertility boosting, hormone balance, all of that stuff. So if you would like that, just let me know. I can send you the link for that one. And if you're watching from somewhere other than my private Facebook group, maybe my Facebook page or my YouTube channel, and you're not already a member of my private Facebook group, you are welcome to join. It's called Hormone Balancing, Fertility, and Beyond. And if you are interested in safer skincare and makeup products to reduce your exposure to toxins that can disrupt hormone balance, which is super important, I do have another Facebook group, another private Facebook group called Safer Skincare and Makeup by Susie Leachy. So you can check that out. There's also a little bit about it on my website. There's a tab for Safer Skincare and Makeup. And lastly, as I alluded to, all my videos are on YouTube and on my Facebook page, which is Health Equilibrium by Susie Leachy. On YouTube, it's just Susie Leachy. So definitely share the love and the knowledge, and that helps me reach other women and keep doing what I'm doing for you all. So Let me know if you have any questions. Feel free to reach out, and have a great rest of your week. I'll see you next time. Thanks for watching.